I know Michael going way back to high school, so it's a couple of years. Well, in terms of passion, because I've seen that passion pretty much from the time we were kids, and he displayed that when he told me, probably when we first started hanging out together, that he wanted to be a pediatrician, and that was his absolute focus.
The first time I really met Michael, he and I were engaged in a discussion around health technology, and there was about 100 people in the room. Michael was sitting up front, and during the middle of it, I had a cough and sort of managed that during my presentation. Didn't know the man. After that, after I'd given my presentation, he'd come up afterwards and said, "I think you have walking pneumonia." And so I really appreciated his humanity in the middle of what was which was very much not about me. He cared more about me at that moment than I did.
For me, the most fulfilling part of my life still remains being a physician. So I still go in every day early and get through my day, and my day goes by fast because I enjoy seeing patients, I enjoy seeing the families. But then when I put that part of my day away and I can add to it the various board work we're doing, the various research parts, the various teaching parts, it's all in a package of great reward for me. I always feel like I receive more than I give, but maybe that's a good thing because it keeps us pushing forward and keep our humility hats on.
I think his caring is quite unique. I think I meet a lot of physicians who are, help support our business, help understand so we can better understand the profession. I've met a lot of physicians who care a great deal about their patients. I haven't met a lot of physicians like Michael who actually care more about the system.
Dr. Michael Giuffre was a student in my executive MBA class about 25 years ago. He never became obsessed with being a leader and having a title and telling people what to do. He's always been inclusive.
So my role as a clinician has had many faces. It's been providing clinical care. It's been teaching students. It's been doing research. It's been linking the medicine with business and recognizing that most healthcare is actually a business. The Haskayne community for me was really a key turning point in my life. It was pivotal in terms of getting involved in the business community and using the expertise that's out there. It also helps us become inclusive and making sure that the voices that need to be heard are heard.
He's obviously a role model and a great example to a lot of people. Not because he's truly a world-renowned and highly respected pediatric cardiologist. That in itself is great. But as a father, as a community member, as a friend, as a son, as a sibling, he is a role model.
We have developed a secure messaging service, and the purpose of the company is so that physicians can talk to their patients, but it's also that physicians can talk to one another. We need to be able to do it securely. We need to be able to manage all of the regulatory challenges around doing it securely. But once we've done that, the ability for a patient to communicate with their physician or a physician to communicate with someone else of the care team, that's something that we specifically designed the product to do.
For me, I think driving change means you have to declare yourself in terms of what your primary objective was. For me, I felt I was a patient advocate. I felt I was a physician advocate. So those hats had huge influence in terms of what I wanted to achieve, what I wanted to help change. And so if you are coming at it with the notion that you're going to surround yourself with the right people, that your attitude is that of a listener, that you're going to bring to the table your expertise but also incorporate others' expertise, then I think the chances of success go way up.
Michael, congratulations on your achievement. I can't think of it going to a more deserving individual.
Congratulations, Bud, on this high honor. You should be very proud. And thank you for doing all that you have done, and keep up the good work.
Dr. Michael Giuffre, you made a difference already. The world desperately needs you to make more of a difference because the world needs you. Go do it.